All right. So lots to talk about today from the vaccination side of the game. Fortunately, really only good things to talk about as far as incidents at the moment. And then we can kind of go around the horn and see if there's any other outstanding discussions. So to start off, as far as kind of our State of the Union, as we normally do, we are back in a downward trend of our rate of positivity, which is the good news. If you go out to the southern tier, I think I saw it yesterday, where the rate of positivity is something like 0.7% of those tested. So that gets you into that range where you're kind of below what would be kind of established as community spread being the norm of how COVID is transmitted. So in smaller areas for sure, and increasingly in all areas, transmission is occurring in small group settings like what we saw pretty much last summer. We are seeing, as we talked about previously, the age range of those affected is shifting younger. And obviously that's because that group is the least likely or not able to be vaccinated at this moment. Although, as we're going to be talking about, that is very likely to change very soon, or at least to some degree. So, I think overall we're in a pretty good spot at the moment. I realize I did not update the percent with at least one vaccine dose. I think we're somewhere around 57% or something like that, if I'm not mistaken. So the number has really gone up fairly significantly, even in the last week or so, which is great. That's good news. We still have significant hesitancy. I think it was Nick Apostolaris that shared with me. There was a really good article in the New York Times dealing with the thought processes behind the groups where there's hesitancy that is, much more nuanced than what we like to believe as red areas and blue areas. But certainly there are folks who have deep-seated trust, who have deep-seated concerns about the safety, who have concerns about religious exclusions that go beyond just political affiliation. And so making sure that we're communicating with those groups is obviously going to be important as we try to march closer and closer towards that herd immunity. And certainly with the Biden administration's goal of reaching the 70% of all adults vaccinated by July 4th, it's going to have to break some of those hesitancy barriers to get there. So more to come on that. I think the 50.7. Okay, so I said 57. I like to round up sometimes. I can only remember so much. So as you can see, our case rate is kind of holding at the moment here locally in Monroe County, even though our percent of positives has gone down once again, which is good. The hospitalization rate is starting to dip downwards a little bit. You'll see that more when we get over to the graphics. The ICU is also starting to dip down, which is good. Unfortunately, you can see we did have 5 deaths reported in the last 24 hours. But on the whole, the mortality rate is holding or potentially downward trending overall, I would say, as of late. So generally, I think we're in a pretty good spot. Obviously, the mission now is, as vaccination continues to increase, even though the numbers who are seeking vaccination is dwindling, and as hopefully summer comes, will that offset what I'll call reopening of the economy with businesses having their restrictions removed, social gatherings being increased? Will those two kind of match each other, or will we be at a point where we can accommodate that? And there is some favorable evidence if we look across the country. Some of the areas that I think we all balked at a little bit as far as removing their social distancing requirements earlier did not seem to have the rate of incline that we feared that they may. So that could certainly bode well for a community that seems to be in a relative degree of control at the moment, such as us. So continuing over to the graphics just for review purposes, we're definitely seeing, the top 2 graphics are never going to trend down. That's a cumulative thing. So if you're waiting for those graphs to turn south, it won't happen, unfortunately. So plateauing is really the goal. When we look at the bottom left, you can see it's slight, but there is that downward trend in rate of positivity that's now dating back really a couple months. If we look on the whole, we've had little blips on the radar screen. But the big is that rate of hospitalization. We had seen that little incline. We were worried that that could be indicative of yet another wave. It does not seem that that has panned out as being a increasing rate of hospitalization, which is good. And certainly the ICU occupancy is going down over the last several weeks, which is certainly good to see. The final graphic, which really just looks at the incidents per day, you can see in the last couple of weeks, we've really kind of taken a dive downwards. Nationally and statewide, Monroe County gets lost in the translation here because our value's relatively small by comparison. But while we're holding steady, you'll see in just a moment from the data that Nick Apostolera shares, most of the other surrounding counties are seeing a downward trend, which is good. So that's all for that. Continuing on, and there it is, yay. So you can see that same either plateauing, or if you look at kind of the very last week or so, the decreasing trend that we're seeing pretty much across the greater Finger Lakes region is certainly good to see. So that's good news. Okay, with that, and there's the final one, yay. But a couple updates as far as testing. So again, our testing availability certainly outstrips demand at this moment. At the end of this month, so I think it's May 26th, the pre-procedural testing that has been going on over East River Road is going to move to Sawgrass. So the 300 East River Road site will close for good on, I think it's May 24th. And then the Sawgrass first floor pre-procedural testing site will open as of May 26th. I'm 99.9% sure I've got those dates right. So again, we're still several weeks down the road, but just giving you guys notice of that. For the moment, everything holds true for its current pace as far as doing it at 300 East River Road for that pre-procedural testing. Now I was going to shift over into the vaccine discussion. So I think the big point that everyone is interested in is the anticipated emergency use authorization for Pfizer for 12 to 15-year-olds, which we anticipate will be coming early next week. And I'm going to hand that over to LJ and company to address that because they've been working on talking about this for some time.
Thanks, Chad. I'll just say a couple of things for the team that's on. First of all, I just wanted to acknowledge that a number of other folks have joined our call today, including colleagues from Rochester Regional, representing RRH and GRIPA, colleagues from the Primary Care Network. We've got Steve Cook, who's joined us, who's been the clinical medical lead on both the state sites and also working with the county sites. Kathy Hiltunen, who's been working COVID since it started, helping with all things, but really focused right now on vaccines. And then there's a couple of practitioners who normally join our call, but ones who have actually piloted doing vaccines in their independent primary care practice. And so we hope to give them an opportunity to talk. And I think what we want to do right now is that be able to give information and open for questions for primary care providers who may have internalized, as a lot of people have appropriately at the beginning of the vaccine effort, that vaccinating out of a primary care practice was going to be very difficult, nearly impossible, particularly if we were restricted to Pfizer vaccine, just because of all of the storage and timing issues and the very, very large allotments of vaccine that were required for practices to accept if they were ordering directly from the state. So there's a lot that has changed. And so I think what we're trying to do is update the teams here on what has changed, provide information to you about some clever strategies that I think Kathy and Steve and Kim Povek and others are cooking up on how they could support practices to get started in this way. And then also give Kevin O'Gara from English Road and others an opportunity to talk about their experience. And I think the thing to mention is we're going to focus on primary care here. That's not the whole effort. I think we all recognize that the state sites and the county sites and the sites that are being set up at schools and school-based health centers are absolutely critical to immunizing our 12 to 15-year-olds as they have been for our 16 and up. But we know it's the early adopters, it's the people without vaccine hesitancy for the most part who are going to go to those sites. And so I think we are not in a bad position for next week when the vaccine, if that indication is dropped. But then we have to really think about what's happening, as Chad noted. And as I think many of us have heard, that population of families who are worried about the vaccine, who are not sure about it, that opportunity to talk with a trusted care provider in primary care to potentially get that vaccine done at their primary care provider's office, that's really huge right now. And so we want to really work together to build that capacity over the next few weeks so that we're ready when that first wave of folks that are done, who are going to the larger sites, and we're ready to be able to begin doing this in primary care settings. So I think that covers everything I wanted to say. And so I'm going to turn it over to Kathy and Steve to be able to give us a little bit of a synopsis of what has changed and what the opportunities are, some of their ideas. And then if they're willing, we'll turn it over to listen to Kevin and any others who'd like to talk about their experience. Kathy and Steve, you want to go?
Sure. Why don't I share that we do have about 10 practices now that are administering vaccine in their setting, and that is just outstanding. These are mostly independent practices. It's about half pediatrics, half adult. And the way that we've done that is they have gotten their own COVID PIN, but they don't pre-book through the state, because when you pre-book through the state, you have to have a certain minimum order. And instead, we provide to them, once they have a COVID PIN, whatever they want, as long as it's at least one vial, because I can't split a vial. So most of these practices have accepted one vial their first week. So they might, if it's Pfizer, they get 6 doses. They pick one day and they get rid of, and they use those 6 doses. After they've done that for a week or two, most of them increase the number of vials they want. I think average has been 20 to 36 doses, something like that. The state used to require that you use it within 7 days. They've removed that. So now we have a couple practices that take 3 weeks worth at a time. That practice does Moderna though, so you can store that for up to 30 days. Pfizer, you can only store in a regular pharmaceutical freezer for 2 weeks. So usually if they're doing Pfizer, that most they're gonna want is a 2-week supply, even though it's good then for an entire week after you defrost it. So you get a total of 3 weeks if you keep it in a freezer and then defrost it. We think, though, that there are practices that will need more than just having the vaccine, that they may need additional education. So we're creating a little SWAT team that could go out to a couple of pilot practices, help them their first day that they're doing vaccination or do training or whatever. I guess that's what's new. Is that what you're looking for what's new?
Yeah, I think that's really helpful. So I just want to clarify one thing, because there is the sense among many of the practices that they have to have the ability to do the deep freeze storage if they're accepting Pfizer. And I just want to clarify again with what you said, they can use, if they participate in vaccines for children and they have a refrigeration freezer storage that is monitored, they are fine to be able to accept Pfizer. Yep. Okay.
With Pfizer, if you don't have deep cold, though, a regular freezer, it's only good for 14 days. Deep cold is good for 6 months.
Nice. Sorry, Kathy, I think that you just answered Dave Topa's question in the chat. I'm trying to watch the chat, so thank you for that.
Oh, okay. A pharmaceutical freezer is one that you're doing continuous monitoring and can be kept within that temperature. So a normal freezer that is -15 to -25 degrees centigrade will meet the needs for Pfizer freezing. A super cold goes up to -70 to -80 degrees centigrade. And those are sort of different animals.
And with the opportunity for distribution to receive allocation from the county, getting allocation once a week or every 2 weeks is fine. Okay.
It's fine. The practice has to pick it up at this time at our location, either at 111 Westfall or Fleet. But we're exploring, might there be a way to do some courier if we needed to? We don't have that quite yet, so it'll be me if somebody really needs it delivered, and that's the way to start. I or my staff will bring it out to you, because once you get going, it's kind of exciting. I think.
Thank you, Kathy. Steve, do you have other things you want to add to what Kathy has said?
Yeah, I want to thank LJ for helping take a step this way because it is really important. I've been at the mass vaccination pod here now. We've been open 106 days. We've done over 200,000 doses, and this is definitely changing a lot. So primary care is going to have to be very key for the next phase of this. There's hesitancy, there's misinformation, and there's also just fear. People are afraid to leave their house still. They have anxiety, and they are afraid to go to a big site like the Dome or something. So they would feel more comfortable with their doctor or something in their community. So our role is going to be really critical. I can tell you that the Dome is already set to vaccinate 12 to 15-year-olds. We've vaccinated over 2,700 16 to 18-year-olds at the Dome, which is like the equivalent of Rush Henrietta, Pittsford, and Brighton high schools. So the state pod will continue to run as long as it can, but our number of first doses or new doses are going down. So the population we need to reach is one that pods aren't good. These large pods aren't good for, and primary care's role is going to be key. And the fact that some of the regulations of handling have changed a lot to make it a lot easier, and the county and AHP and GRIPA helping us think of strategies. We want to figure out a couple ways to do this on small scale and then see how we can expand it out. You can do this. It doesn't fit in our usual routine of vaccinating because you can't give another vaccine within 2 weeks of this. So if a 12-year-old comes in and you give them their HPV, they got to wait 2 more weeks before they can get their COVID. So, that's probably the biggest glitch that we run into. And I can tell you there's not nearly the number of reactions people seem to want to worry about. But, we're used to handling this stuff in our offices. So the common things are common.
Thanks for that, Steve. I'm going to channel a few questions from the chat just to highlight if people aren't looking in the chat. And then I was going to ask for Kevin to speak to their experience. The question that came up of whether the Dome is just providing Pfizer. You are a Pfizer operation there. And I saw John Clark responded to that. There's another question. I'm working backwards, you guys, so I'll get to the earlier ones. I'm looking and seeing the question about a really good point. Is any pediatrician giving it to the teen and the parents? And so I'm going to answer that and then let Kathy jump in too. But it is our understanding that for this vaccine, that is completely appropriate and would be a wonderful strategy. So it's another way to utilize more of the vaccine efficiently, but also to get to some families who may need that conversation. So you can vaccinate the teen, you can vaccinate their family or caregivers at the same time. So that's definitely acceptable. Thanks, Tim, for bringing that forward. The other question in the chat is just, are there any additional patient registration things that are required for vaccinations that would be outside of the normal NICES reporting that practices do for their patient vaccinations? And I think, Kathy, I don't know if you want to take that or that'd be great.
Yeah. In addition to the uploading of NICES, there's a twice weekly vaccine tracker that a provider needs to submit. It's pretty simple. It says, how many did you vaccinate this week? How much did you waste?
And Kathy, is that something, when you guys talked about those strike teams or SWAT teams that might be able to go out and help practices, it feels to me like this almost needs like a really good toolkit, orientation, training up. I mean, our practices know how to vaccinate, but it's a little bit of a different approach and strategy. You want to get it right the first time. Mm-hmm. So you guys would be able to teach and coach the teams and the practices on this. Mm-hmm. With Pfizer, Janet Cranshaw is asking, can you use part of the vial and save the other part for the next day, or do you have to use all doses on the same day?
And I said you have to use it all the same day. If it's kept in its refrigerated state, it's good for 6 hours after dilution, and that's what we would suggest you do.
So I know that there's been lots of talk before. One of the hesitancies for practices to engage with the state on this had been all the issues about waste, and that if you're wasting a dose, you're not going to get any more, that mm-hmm. sort of thing. And I mean, none of us like to waste anything with this, but it sounds to me like now we have all this vaccine and we don't have the people to immunize. So can you comment on that?
Yeah, they've removed all the penalties for doing odd things. Like if you have too much waste, it used to be you wouldn't get the vaccine, or if you vaccinated people who weren't eligible, you could get fines. They've taken all of that away. I even got in writing yesterday from the state, do not hesitate to give vaccine to a willing arm, even if it means you won't use up the vial. And I was like, whoa, I'm sure they don't mean waste half the vaccine you get, but it was so nice to get that because we've been keeping the wastage really, really, really low. And I think as we expand, go from, 10 or 15 providers to maybe 1,000, that waste will go up, and that's okay.
Okay, I think that's a really important message for our teams to know. This is very, I just think there's so much that's different in this, and that's why we have to have this conversation and entertain these questions. Kevin O'Gara, you're not on my screen right now, but I'm finding you. I saw you on before. I wonder if you'd be willing to unmute and talk about what your experience has been at English Road, because you all have been doing 2 workflows, right? You've been doing vaccine clinics. I know you've partnered with schools, and I think you've been doing some vaccination as part of your normal business with patients coming in. So are you still there? Kevin appears to be still muted. All right. So I'm going to open it, and Kevin, unmute yourself if you're able to at whatever point that you can. I think that if there's any other practices you've been doing this, I know besides English Road, I know that. Sorry. Oh, there you are. Awesome. I was vamping. I was going to start singing in a minute, and that was going to be really embarrassing, or tap dancing. And so if you just saved me, thank you.
No, that's okay. I found the unmute. Thank you. Yeah, I can just kind of summarize some of the stuff we've been doing, and certainly look for anybody else if they've figured out how to take the next step would be great. We did a couple Moderna clinics when that was the only thing available. We did it on Saturdays. Each of the first 2 weeks we did 100, and we did anybody we could get to sign up. So families, grandparents, people in the community who heard about it. We had kind of everybody coming in, people with walkers and everything. So we're doing the second of that second week this Saturday to finish that group up. And then we kind of moved to doing it more during our normal business hours. So we started doing Wednesdays and Fridays, Wednesdays in the evening, like from 4 to 7. And then Fridays we're doing like 1 to 5, just kind of 2 different time frames. And like everyone else has said, the interest in getting it has significantly dropped off. So we've just, week by week been picking up the vaccine that we had people scheduled for. So a couple of things, I kind of had a question of is, how feasible is it to get a freezer appropriate so we can store more for a longer period of time? And then how do we move toward being able to offer the vaccine, not for pre-scheduled visits, which is all that we've done so far, but for, kids who are coming in and age appropriate for well visits. How feasible is that to move toward, and, without wasting, most of a vial on most days you open one and having, freezer storage. I'm not sure how we could, get to that point. As far as all the reporting and all that kind of stuff, we were really worried about that initially, getting everything reported the nicest. So we have anyone who signs up who is our patient is easy because they're already on my EMR, and every day everything that's on our system gets uploaded to NICES. People who aren't our patient, whether it's a parent, grandparent, we have them fill out just a form that they can actually go to our website and click on, and then we get all their information into our system, and then just at the end of the day, after we give the vaccine, their information automatically uploads to NICES as well. So I think that's
Kevin,
kind of.
Do I remember that you also tapped into some volunteers from the United Way volunteer pool to help?
Yeah, we still have to work that out a little bit. We contacted them and we put out the second Moderna clinic last Saturday, and we didn't get any response. So we thought maybe, we didn't have anybody, and then 4 people showed up. So we need to figure out, and they said they signed up like a week earlier. So we need to figure out how we can know ahead of time who's coming and not just have, everybody show up without knowing. 2 of the people ended up being EMTs, so we just utilized them to watch people, for their 15 minutes. And, the other people said, well, if you don't need me, I'll leave. So we ended up having 2 people that helped out.
Got it. Kevin, thank you so much. I'm going to put one other person on the spot. They don't know it, but I saw him wish me a happy birthday in the chat. And I believe that Diego has been having great success in his practice doing this. Lucia is calling you out privately in the direct chat to me too. So Diego, do you mind unmuting and talking about your experience?
Yeah,
No,
thanks,
no
LJ.
Thank you, LJ. No,
we basically were able to administer over 800 vaccines at the office. We did something similar on Saturdays. We had 2 Moderna clinics. We gave 200 vaccines each time. We were able to get 400 doses of Johnson & Johnson vaccine as well. And we did that in 2 different ways. We had a Saturday clinic for one of them, but we also administered that throughout the work week. So we basically had a nurse and a secretary outside collecting the data, and we had a vaccine forum in our lobby, and so people would come in and get their vaccine, and then the back part of our office we created a waiting room for the 15 minutes where they watched an informational video that we prepared for the particular vaccines they got. So we were able to have a pretty good workflow during the day, so people could get their vaccine in the office and go to the waiting room, or get it at the start of their visit and then get it as well, stay the 50 minutes during their visit, during their physical, and walk out. So it was very effective. We, on the last 200 doses, we struggled to get 200 people, so we offered it to their friends and family. So we had them come in. We had to get their data to put back into our computer system and upload it to NICES. So we've gone on pause, and what we're doing now is we're having our office do an audit from NICES to repopulate our charts on who's gotten vaccine elsewhere. We found a lot of people having vaccine, and as soon as we generate a clean list of people not getting vaccine, we're gonna then reorder and probably open it up again for that vaccination.
So Diego and Kevin, these are great workflows. I know Charlene Connors also has had good success too. I think one of the questions in the chat is, did you create charts for all of these other people, or was it just really entry into NICE? How did you handle the people who were not your patients?
Yeah, we had to create a chart for everybody to input their data in order to be able to upload that. So yes, we put them into our database. As soon as they're done with their vaccines, then we inactivate the chart.
So that you're not going to be responsible for those patients ultimately.
Correct, because otherwise the Arcadia, then Chad gets on my case for all the
Oh yeah, we don't want Chad on your case, man. Like, we'll do anything to help avoid that happening.
Yeah, and if anybody has questions about workflow, happy to have offline conversations about that, because it actually works very nice, and patients love coming to the office, right? I have a feeling that this, that is really the number one thing, and they are so much more comfortable asking questions and be able to address their concerns, directly with their particular provider.
That's excellent. So I think we covered the questions during the chat right now. I'm going to summarize what I heard. I'm thinking about it, being in practice, what would I want to think about if I'm not already someone who's moving in this direction or already doing vaccines? So it sounds like the very first thing, and Kathy, Steve, Diego, Kevin, anybody else, correct me if I'm wrong, you need to get a PIN, right? In order to receive vaccine, whether it's from the county or from the state, you need the PIN. So I know that Renee included information on that in the invite for today, but we want to be sure that people know that that's a step that still doesn't require that you participate, but you can't participate if you don't have the PIN. It's your ticket to entry. So we really encourage practices who don't have that to go ahead. And then I think what I heard from Kathy was they are interested in hearing if there are practices who are who have their PIN and are wanting to sort of pilot this strike team approach. To try to help your practices get set up. Is that right? And you have capacity for a few practices.
I would start with 2 right away, because
Okay.
it'd be me and an LPN, and I might encourage some of the other folks that I have to get trained to do that as well. Yeah, I'm really itching to try it because I think we need to get to the next level. Although, Diego, oh my gosh, you guys are just such stars.
Well, and that
You're doing
leads to
better than some inner city pods that we've had ongoing. You're just amazing.
Well, I think that's my next point is like, we are super fortunate to have Diego, Charlene, Kevin, Arundicoit Peds, I think Long Pond Peds is doing this too. Like, we've got a number of people who I would not ask for a ton of their time, but could serve as some consultants in this if people had questions. And I think what we want to try to do is streamline this as much as possible so as many practices can, get ready and are starting in this fashion. Chad put in the chat about when the single dose vials would be available, and Kathy responded that that's a ways off, right, Kathy? That's a few months off at least, probably.
I have no information on it, which makes me think it's a little ways off. I wouldn't be in the loop. Pfizer doesn't, but I haven't heard anything yet.
Yeah.
What did come out on May 3rd was that you could do the pre-draw if it's a last resort and there's no other option. So we're not encouraging that. We want the vaccine drawn at the site where it's being given.
But even having practices start in a small fashion right now would help move the needle so that when people are ready to, whether the state begins doing single dose vials, whenever that is available, you know, it preps us, it primes us to be doing this. And for anybody who takes care of kids, there's going to be a boatload of children who are going to need this whenever the age range drops down. I think the other thing the other point I just wanted to make in this is that we have a lot of providers on this call who are not in Monroe County. They are in other Finger Lakes counties. And so I know through the Vaccine Hub and through work from Jackie Lytle with the Say2 network, they are figuring out what is needed and what is available in terms of resources and strategies for practices that are not specifically within Monroe County. Kathy or Steve, would you have any other comments? I don't have more to share at this moment right now. I have messaged Jackie to see what's happening in that space, and we will definitely share updates with all of you.
I'll share what we're doing right now for non-Monroe County primary cares. If they have a COVID PIN and their local health department can't do what we're doing for whatever reason, we will redistribute, but it means that someone from the practice is to come pick it up. So I actually have three practices outside Monroe County that get vaccine from us, and that's fine too. The state's taken away all of these boundaries. We don't just have to vaccinate within our own county or our own state. We're vaccinating Canadians that visit us in Rochester. So people from out of country, if they're here, they could infect us if they get exposed. And if we vaccinate them, they won't. So from my perspective, that's fine.
Thank you, Kathy. I think that I saw Lucia messaging she needs to step off for another meeting. I just wanted to call out the excellent work that Lucia and the team at Monroe County Medical Society has done in terms of providing information, making connections for all of our practices. It's just invaluable and we're really grateful. I don't know if you're still there to hear that, Lucia, but maybe somebody will tell you that I said that. Oh, you're there.
I did, and I'm about to shut down. So thank you
Okay.
so much.
You
It's
bet.
a team effort, right? So
Yeah.
thank you.
You
All
better
right,
believe
that's
it. It's a team effort. So there is a question in the chat. Diego, I wonder if you could address the question about consent. Did you happen to see
Yeah,
that?
so that consent form from New York State, the way we went around that, especially for the patients that were not our patient, we had a QR code where they came into the office, which they could then put on their phone. And while they waited for their 50 minutes, the person supervising that room made sure they completed the form. And so they completed that New York form on their phone directly. If they didn't have a smartphone, the person in the back had a laptop computer, and basically inputted their information into that New York consent.
That's great information.
And there's always paper backup. You can always there's a paper backup consent form if you have to.
So I think that we recognize that the various hospital-owned practices and the hospital systems are working out their processes. And that I can say, for example, Gossano Children's Hospital's pediatric practice and specialty services are working with URMC Pharmacy to figure out a distribution plan and to lift exactly this kind of model. And Rochester Regional, I know from speaking with Stephen Schultz, they are working on their approach. I think that what we've talked about here, though, is particularly key for independently owned practices to be able to provide that support and move things forward. So I'm just wondering, it looks like we got about 9 minutes left. Are there other questions that people have that they would like to have answered by this great team of folks on the call? I'm opening that first. You can unmute yourself and ask, feel free, or you can throw something into the chat. I am not seeing anything new in the chat. I'm not seeing any of you unmute yourselves. So then I'm turning it back to the rest of the team on the call. So to Kathy, to Steve, Diego, Kevin, Charlene, if you're on and want to unmute, or anybody else have any other comments or words of wisdom they would want to share with folks here?
So I am typing, but I'm not going to do a spell check, so it's going to look terrible. But there was a question about the transport container. You can use a beer cooler. The main thing is that you have a temp monitoring device and you put coolants in it. There is a process to do what we call the sandwich method, where you put a super cold water bottle that has some ice in it, but it can swirl. And then you put cardboard, then you put bubble wrap, then you put the vaccine, then bubble wrap, and it sort of sandwiches it so that you never freeze the vaccine. This is in a refrigerated state. And it's very inexpensive. If anyone needs a styrofoam container, I have about 200 of them, because the vaccine comes in styrofoam and we archive it a little bit, then we start tossing them. So I just gave one to an office today. I said, why don't you just take this? It's fine.
Thank you for answering that, Kathy. There's a new question in the chat. Do we have any guidance from New York State on summer camps, or an idea of when that might be available, when that guidance might be available around physicals testing or vaccinations? I don't know that. Kathy, do you know?
Oh, someone in this building knows it. And they're having a call right now on it, of course. Summer camps will be open. Probably, I'm going to make this up now, but probably testing will be required, because it's being required for any large type setting. I can get back to you on it though.
That's great. If you have information to share, we can certainly share out through the networks and provide that to folks. So I'm now going to ask, because you're also quiet. We've trained ourselves to not like show our faces and unmute ourselves very often. I don't know, this is a new social mode. I would like to ask for practices that would be considering, not doing, but considering getting their PIN number. If you could raise your hands or say yay or whatever it is. I just want to get a sense of where people are at. And if you're feeling like you're not, what would help you feel more comfortable with that? And now I'm staring at all of your boxes, putting you on the spot. I'm seeing a thumbs up.
Or put your name in the chat.
Or you can put your name in the chat. Okay, awesome. There we go. There we go. There we go. Okay, perfect. You guys are great. Okay, just keep those things coming. If anybody after this call would like to be one of these first, 2 practices, I feel like I'm giving away like a lottery thing or whatever, or a giveaway, would like to be one of the 2 first practices to participate with a strike team, please call Kathy Hiltunen. There you go, Kathy, at 697-4894. That's 697-4894. You guys are awesome. We've got to do this together, and we've done it now for over a year. We want to make this, I would just say this right now. AHP, GRIPA, any of us who work with the independent practices, we are not the experts in this space, but if we can help connect you to the experts and make this happen, like, we are willing to help in that space. So any last comments, Chad? Never put yourself in the chat.
That's probably a good thing to point out. A couple quick points Diego did bring up, and it's probably a good thing to talk about here, the Excelsior Pass for New York State. So it's an app you can download on your phone. You input your information. There you go, point in queue. So good and bad of the Excelsior Pass. It is your entry card for many things. We start talking about events, and I haven't heard about summer camps requiring it. Everybody's got one. I got mine too. I feel like the guy that's not showing it right now. But the one downside is the Excelsior Pass will say that it expires 6 months from the date of your second dose or of your completing dose of the vaccine. My understanding, and all the smarter people on this phone on call can correct me, is that is not a firm line drawn in the sand. That's just what they chose for the moment, and that will be extended as they get better data. Because initially New York State was saying 90 days post your second dose was when you're expiring. Now the Excelsior Pass says 6 months. My understanding is that will continue to be kicked out, but for now, I know mine expires sometime like the end of July or August or something like that. So anyway, that is a good thing to have. It will be required for Bills games, concerts, all that may be coming up over the summer and fall at this moment. The other thing that I will just point out, and we will share this back with you as we get more, everyone's probably well aware that May 19th is the magical day where everything goes back to reopen and we're back to full steam again, or at least some semblance of that. The CDC has also put out some renewed guidance about when is it appropriate that folks who have been vaccinated could unmask, what settings. And already there's been a lot of questions about what happens when it's small groups of staff who are eating, all of whom have been vaccinated, who are eating in a break room. What happens with, we have staff meetings, we have small groups with everyone vaccinated. Could people unmask? So there is a systems leader meeting. I don't know how that plural goes there. At the U of R, we met once. There were some really good points and considerations brought up by infection prevention. The second iteration of that, I believe, is tomorrow, if I'm not mistaken. So there will be some recommendations that at least the U of R is going to put forward. But I think we're going to have to address the fact that staff members are going to start coming to us and saying, look, I can go to McDonald's and don't have to wear a mask if I'm vaccinated, but I come here and have lunch with my coworkers, all of whom are vaccinated, and you're telling me I should be wearing a mask or I should be maintaining this amount of distancing. So just know that is going to be a discussion. We'll try to put forward some of the best practice recommendations that we get from the infection prevention teams as those come forward. I think that's all I've got there. Renee, anything you have? No? Okay.
You got it all covered.
All right. So for now, we will stick to our 2 weeks from today. Obviously, if there's major breakthroughs or stuff, we will send that out in the email communications. Or if there's a reason that we need to get back together sooner, we certainly will. But fire your questions off if you have them. Folks have been great about doing that, and we will try to answer them as quickly and efficiently as we can. So thank you, everyone. We got covered a lot today, and we'll see you back in 2 weeks' time.
Thanks, everybody.
Take care,
Thanks,
everybody.
Kathy and Steve.
Yes.